Hello, hi, namaskar. I am Ashwini Kumar. Welcome to the Asik Academy online study. In this video, today will be discuss about the health and physical assessment, nursing MCQs with rationale, so that you can learn faster, understand deeper with confidence. So, with no delay, let's start. Question number one: during the assessment of a patient's cardiovascular system, the nurse ausculted a high-pitched blowing sound heard during systole. During find is consistent with which of the following? Options are S3 heart sound, split second heart sound, systolic murmur, and diastolic murmur. Here, the systolic murmur is the right answer because a high pitched blowing sound heard during the systole indicates a systolic murmur. Systolic murmur are used by turbulent blood flow through the valve during the ventricular contraction. Question number 2. Which of the following techniques would the nurse use to assess the patient's cranial nerve to optic nerve? Assessing the pupillar response, testing the visual acuity, performing the Romberg test, and checking the facial symmetry. The correct option is testing the visual acuity because the cranial nerve 2 or optic nerve is responsible for vision. Testing the visual acuity, such as the using Snellen's chart, evaluate the function of this nerve. Next question. When assessing the patient's abdomen, the nurse should perform which of the following techniques at last? Options are percussion, auscultation, inspection, and palpation. The correct option is palpation because the palpation is usually performed the last during the abdominal assessment to prevent altering the bowel movement or causing the discomfort to the patient. If the question is asked the patient's of abdomen, for assessing the patient's abdomen, the nurses should perform the following techniques at first. That will be the answer inspection. Next question. Question number 4. During the respiratory assessment, the nurse hear a high pitched continuous musical sound during the inspiration and expiration. This finding is consistent with wheezes, raunchy, crackles, stridor. The correct option is wheezes because wheezes are a high pitched continuous musical sound heard during the inspiration and expiration. They often indicate the narrowed airway as seen in conditions such as asthma and bronchospasm. Next question. Question number 5. When assessing the patient's cranial nerve, which of the following tests would evaluate the cranial nerve 1? Cranial nerve, we all know that it is olfactory nerve. Options are assessing the pupillary response, testing the tongue movement and strength, performing the Romberg test, and checking the sense of smell. The correct option is here checking the sense of smell. Rationale is this olfactory nerve is responsible for sense of smell, testing the patient's ability to identify the familiar scents evaluates the function of this nerve. Question number 6. During the assessment of a patient's musculoskeletal system, the nurse asked the patient to bend forward and touch the toes. These maneuvers assess which of the following: muscle strength, range of motion, joint stability, coordination. The correct option is range of motion because asking the patient to bend forward and to touch the toes as toe assessment, the range of motion of the spine and lower back. Next question. Which of the following assessment finding consistent with a normal respiratory rate for an adult? Options are 8 breaths per minute, 16 breaths per minute, 24 breaths per minute, 32 breaths per minute. The correct option is 16 breaths per minute. A respiratory rate 16 breaths per minute within a normal range for adult, which is typically range 12 to 20 breaths per minute. Question number 8. When performing the neurological assessment, the nurse tests the patient's ability to recognize sharp and dull sensation. Which cranial nerve is being assessed? Cranial nerve 5, cranial nerve 7, cranial nerve 9, cranial nerve 10. The correct option is option A, cranial nerve 5, that is trigeminal. A trigeminal nerve is responsible for sensory information from the face, testing the patient's ability to recognize the sharp and dull sensation, assessing the snore. Question number 9. During the assessment of a patient's cardiovascular system, the nurse palpate the weak, thready pulse, and these findings may indicate hypertension, fluid overload, peripheral vascular disease, and hypovolemia. Here, the correct option is option D, hypovolemia. Because the rationale is a weak thready pulse is often associated with the hypovolemia or decrease the blood volume. It can be caused by the conditions such as bleeding, dehydration, or shock. Question number 10. When assessing the patient's cranial nerve, which of the following tests would evaluate the cranial nerve 9? Options are assessing the pupillary response, testing tongue movement and strength, performing the rumble test, checking the shoulder strength. The correct option is option D, checking shoulder strength test. Question number 11. When assessing a patient cranial nerve, which of the following tests would evaluate the cranial nerve 12? That is hypoglossal. Options are assessing the pupillary response, testing the tongue movement and strength, performing the rumble test, checking the hearing acuity. The correct option is here the testing tongue movement and strength because this cranial nerve, that is hypoglossal, is responsible for tongue movement and strength. Question number 12. During the assessment of a patient's skin, the nurse notes the rendered area that blanches when the pressure is applied. Which of the following consistent with cyanosis, jaundice, arrhythmia, pallor? The correct option is arrhythmia because arrhythmia refers to the localized redness of the skin. When the pressure is applied, the area blanches, including that the redness is caused by vasodilation. Next question. When assessing the patient's cranial nerve, which of the following tests would evaluate the cranial nerve 3, that is oculomotor? Options are assessing the pupillary response, testing the tongue movement and strength, performing the Romberg test, and checking the extraocular movement. The correct option is checking the extraocular movement. The rationale is this oculomotor nerve is responsible for eye movement and a pupil constriction. Checking the patient's ability to move the eye in different directions evaluate the function of this nerve. Question number 14. During the assessment of a patient's respiratory system, the nurse auscultate fine cracking sound heard during the inspiration. This finding is consistent with S3 heart sound, wheeze, ronking, and crackles. The correct option is crackles. Crackles are fine cracking sounds during the inspiration. They are often associated with a fluid or inflammation of the airway and lungs. Question number 15. Which of the following assessment finding is considered abnormal for the patient's skin turgor? Options are elastic and resilient, tending when pinched, slow return to the normal shape, and moist and supple. Here the correct option is tenting when pinched. The skin turgor refers to the skin's elasticity and ability to return to its the normal shape after being pinched. Tenting, where the skin is remains elevated or takes a longer time to return to the normal position, it is an abnormal findings and may indicate the dehydration. So this is all about in this video the health and physical assessment, and next things will be discussed on the another video. Thank you.